syndrome. So the risk factors, the mechanism, clinical features, and prevention. So refeeding syndrome, who are at risk? People who are severely malnourished, such as people who are chronic alcoholics. Why does it happen? Because when you refeed someone, the fat metabolism that's in the starvation phase converts to a carbohydrate metabolism. So whenever you have carbohydrate metabolism, there is increase in insulin because you have more availability of glucose and the insulin level will rise sharply. And that will cause shift of electrolytes into the cell, such as potassium shift, phosphate shift, and magnesium shift. And those will lead to a decreased serum level of those electrolytes, leading to hypokalemia, hypophosphatemia, and hypomagnesemia. How does it present? First of all, the classic features of those electrolyte abnormalities, such as vomiting, muscular weakness. And if this muscle weakness is the diaphragmatic muscle, then that will lead to a respiratory depression. Hypomagnesemia can lead to seizure. Hypokalemia and hypomagnesemia both increase the QT interval and can lead to a ventricular arrhythmia and even cardiac arrest. Arrhythmia and arrest. How to prevent? First of all, you start slow. So calculate the requirement and give only 50% of the requirement and regularly monitor the potassium, magnesium, and phosphate levels to screen for any complications at the early onset. Another thing that happens that I forgot to mention is the thiamine. So anytime you refeed someone, the thiamine level will go down because you have a lot of carbohydrate and thiamine stores are already low. And if you introduce a lot of carbohydrate, the thiamine levels will be even lower to metabolize those carbohydrates. So there could be a thiamine deficiency, which might lead to an wernic encephalopathy. And that is another condition or complication that you have to keep in mind. So start slow, give thiamine in people who are susceptible for thiamine deficiency and Wernicke syndrome or Wernicke encephalopathy, and monitor the electrolyte levels.